Hello，大家好，我是 Dr.Sun。今天我想给大家讲一下血脂异常。首先，我会给大家讲一下血脂异常的定义，包括医生如何用血脂的结果来决定一个病人的10年心管危机的可能性。然后呢，再给大家讲一下一些加拿大医生常给病人开的一些降血脂的药物，然后包括这些药物的副作用。Hello everyone, welcome to my channel. My name is Dr. Sun, and today I would like to talk a bit about dyslipidemia. I'm going to go over the definition of dyslipidemia, the screening age when patients should be tested for dyslipidemia, and also how we calculate the risk factors for cardiovascular disease and to determine whether or not a patient needs to be on a statin, which is a cholesterol lowering medication. And I'll end off the video by talking about the side effects of statin and what you should look for while you're starting your medication on statin. So for healthy individuals with no prior history of any cardiovascular disease, men should screen for dyslipidemia at age 40 and above, and women should start screening for dyslipidemia at age 50 and above. And depending on the results that we get from the lipid testing, we then calculate the 10-year cardiovascular disease risk. I'll show you how we calculate this risk in a few seconds, but I just want to let you take a look at how we categorize the patient. So for a patient with less than 10% of developing cardiovascular disease in the next 10 years, we do not suggest medication, whereas for the patients in the category between 10 and 19%, we suggest moderate potency of statin, which is a cholesterol lowering medication. And for patients that have a greater than 20% risk, we suggest high potency statin with the patient. If we go above here, patients that already had a history of cardiovascular disease, these patients go right into the high-risk category, and they should be on a high-potency statin based on their prior medical history. So here we have the Framingham risk calculator to estimate the 10-year cardiovascular risk of an individual patient. So for instance, if we have a fairly healthy 60-year-old woman, I'll show you how this risk factors is being calculated. So if this is a healthy 60-year-old woman that is not a smoker, not a diabetic, has a normal blood pressure and a normal cholesterol, let's say it's at 5, and high density lipoprotein is the good cholesterol, so you want this higher, and let's say she's healthy and is at 2, and she doesn't have any chronic kidney disease and no family history of any early cardiac issues. And so you can look here and see that her risk in the next 10 years of having a cardiovascular event is low. So this would be a patient that would not benefit from a statin or any sort of cholesterol lowering medication. However, if we use the same 60-year-old patient who is unhealthy, who is a smoker, a diabetic, has hypertension, let's say at 140, also has high total cholesterol, let's say at 7, has low high density lipoprotein, and having chronic kidney disease, you can see that the percentage of having an event in the next 10 years has gone up significantly. And this would be a patient that would benefit from being treated with a statin. The most common side effect of statin use is muscle aches and pain. There are more serious side effects, but they're exceedingly rare, such as complete breakdown of the muscle, liver failure, or kidney dysfunction. And the incidence of these side effects will increase with increasing statin dosing. Statin-induced muscle aches and pain typically present as symmetrical weakness or pain, and they tend to affect the larger group muscles. The muscle aches and pain can vary from generalized fatigue or to functional impairments such as difficulty raising their arm above their head or standing up from a seated position. The onset of muscle symptoms is usually within weeks to months after starting the statin therapy, but they can occur at any time during the treatment. Most patients that end up having these side effects usually have their muscle symptoms within 6 months of starting the statin therapy. And muscle pain and aches will resolve once the patient discontinued the medication. So here we have the dosing of the most common statins that are prescribed by doctors. The higher the dosage, the more effective it is in reducing the baseline risk of a cardiovascular event. However, the side effects will also increase with increasing dosing. So when you actually do have side effects such as muscle pain or aches, you should stop the medication and talk to your doctor. And depending on the timing of the symptom, location and severity of the muscle pain, and the current dosing of your statin, your doctor will decide whether you should lower the dosage or switch to a different statin. And cholesterol synthesis occurs at nighttime, so it is recommended that you take your statin medication at night or at bedtime. Now that is it for my presentation. Thank you for listening, and I'll see you next time. 在没有心血管疾病的人群中，男人40岁以上和女人50岁以上就应该做血脂体检。给大家看一下医生是如何计算一个病人的10年心血管危机。比如说我有一个非常健康的60岁的女病人，她不抽烟，也没有糖尿病，然后血压也正常，然后她的胆固醇也是在正常的范围内，然后高密度胆固醇也是在正常的范围内，然后她也没有任何的慢性肾病，然后也没有家庭历史方面的心血管疾病。你能看到她在未来的10年里，她得心血管的病的可能性非常的小，所以这样的病人他就不需要吃这种 statin 的药物。但假如说同样的病人，他抽烟，然后也有糖尿病，然后他也有高血压比如说在140左右，然后他的总胆固醇在7，然后高密度胆固醇比较低，在1，然后再加上假如说他也有慢性的肾病的话，你能看到他这个得心血管病的可能性就增高了很多。所以这样的病人的话，他就需要吃这个高量的这个 statin 的药。在这里假如说他要是吃了这个 high intensity statin 高量的这个 statin 药物的话，他就可以把这个得心血管的可能性降低了。所以这也是这个药的一个作用，它不仅降低了你的胆固醇，它也帮助病人防止得心血管病。医生会把病人分成3类，一是得心血管可能性小于10，这些病人就不需要吃任何的药物。心血管的可能性在10%到19%的话，医生会建议病人去使用中量的药物。当一个病人的10年心血管危机要是大于20%的话，医生会建议病人去使用高量的 statin 药物。在这上我们看到，假如说一个病人要是已经有了心血管疾病或者是中风，他们直接就应该使用这个高量的 statin 药物。这个表格里有医生给病人开的最常见的 statin， 这里有不同的 statin 药物，包括不同的药量。当药量增加的时候，病人得副作用的可能性也会增加。Statin 药的最常见的副作用是肌肉疼痛，有些病人会感觉到肌肉酸痛，到有些病人会感觉到大腿是无力。更严重的副作用包括肌肉融化，但是这是非常非常少见的一个副作用。还有一些比较少见的副作用包括肾衰竭或者是肝功能受到一些影响。Statin 药物引起的肌肉酸痛一般是对称的，而且影响的主要是大腿和臂里。一般病人吃了这个药之后，在几周或者在几个月之后会有可能感觉到这些的副作用。大多数的人一般都是在使用这个药6个月之内。当一个病人吃 statin 药物要是有副作用的话，我首先会问他这个肌肉的这个疼痛具体是在哪儿，然后我还会问他这个副作用是吃药4周以内呢，还是说3个月以后得到的这个副作用。 然后当这个病人把这个药停了之后呢，他这个疼痛是不是在2周以内停止了，或者在4周以后停止？我是通过这3个问题来决定这个病人是应该是降低他现在的药量，或者是停止他现在所用的这个 statin 药，然后换成另外一种的 statin 药。因为这个 statin 有很多种，当一个 statin 药对病人有副作用的话，医生会很容易把这个药停止，然后换到另外一种 statin 的药物。身体里的胆固醇是在夜间形成的，所以 statin 这样的降胆固醇的药物最好是在夜间服用。好了，这一期我就讲到这里，我们下期再见。